Professor Dr.Tuphan Kanti Dolai, Professor and Head Hematology Department in RS Medical College. You know the infection is the major concern in majority of the hematological diseases. Starting from the malignancy, starting from the bone marrow transplant, and starting from the other benign disorder, particularly the bone marrow failure syndrome cases. And the majority of the patient is died due to the infections, apart from the relapse and the refractory cases. And infection is the major culprits we call the febrile neutropenia. In that febrile neutropenia, around 30% of the cases we are able to find out the different etiology of the cause of infections. But the 80% of the cases we are unable to find out the etiology. So patients are blend up with the infections. It may be the bacterial infection, it may be the fungal infection, and in rare situation it may be the viral infection also. So hematologists should be aware, and the general public should be aware how to prevent the infections, and more important is that how we have to initiate the antibiotic as early as possible in high risk group of the patients. You should always start the broad spectrum antibiotics agent, starting from the piperacin, tazobactam, ceftriaxone, sulbactam, or you can use the meropenem also, along with your antibacterial coverage, particularly the gram positive coverage, and subsequently if the fever persists, then you have to prompt use of the antifungal. Particularly you can use the amphotericin B, you can use the caspofungin, you can use the voriconazole depending upon the situations. So the infection is the major threat, infection is the major concern, and multi-drug resistance organism nowadays, particularly the Acinetobacter, the multi-drug resistance Klebsiella, and also the more recently the Candida aureus is the major threat and the major concern for the physicians, those who have been treating with majority of the hematological disorder who are land up with the infections. So be aware, be treated, and try to keep your safe patients with broad spectrum early initiation of antibacterial agents and antifungal agents.